Okay, I have a condition called EOE. Every time I take a bite of food, my esophagus doesn't open up and it gets stuck, and I have to drink water to push it down. And if I take too big of a bite, it just gets stuck, and I have to get it removed at the hospital. So I'm speed running 6 eggs without water to see what happens. It won't go down. Yeah, that's as far as I.
So if like him, if you have food that keeps getting stuck or you have reflux that won't quit, think EOE or eosinophilic esophagitis. This is when a type of white blood cell called an eosinophil causes inflammation in our swallowing pipe or our esophagus. This occurs in people that usually have other type of allergic conditions such as allergic rhinitis, asthma, and eczema. These eosinophils usually help us fight parasitic infections and are present in all body tissues except really the esophagus or the swallowing pipe. Certain foods can trigger type 2 inflammation, which causes these eosinophils to migrate to the esophageal mucosa. Here they cause injury and can stiffen your swallowing pipe. In young kids, symptoms usually start as vomiting and feeding issues, and in teens and adults, it usually starts with heartburn, followed by slow eating or trouble swallowing, and eventually with food getting stuck. The diagnosis is made by endoscopy, and this is what it looks like.
This is what a normal esophagus looks like. You can see pink, smooth mucosa. And then the other three pictures are esophageal rings that are characteristic of eosinophilic esophagitis. And sometimes the first time we diagnose this is when a patient comes in with this, which is chicken or steak stuck in the esophagus.
So those rings are very typical of EOE, but we also need a biopsy showing 15 eosinophils per high-powered field. For treatment, we usually start with a PPI acid blocker. I then use skin prick-directed food elimination. We usually start with milk and wheat. We can also use swallowed steroids such as budesonide or fluticasone. And if food elimination and steroids are not enough, there's a new FDA-approved treatment called dupilumab. This is an injection that blocks the inflammatory cytokines IL-4 and IL-13, which are responsible for eosinophil growth.